Welcome, everybody. Thank you for joining us today. Welcome to the 7 Solutions to Dementia Care Challenges. We are going to give you solutions that are going to help you have tips that will save you from heartache, overwhelming stress, and confusion. Hopefully, these will provide you with some helpful tips for your daily challenges. My name is Paige Fairbanks-Gunn. I'm one of the regional managers for Kelch Communities. I live in the Arizona region, and we have independent living, assisted living, and most of our communities are memory care communities. I've been in the industry since 1997, and I'm coming up on probably close to working with about 7,000 families. And I'm excited to be here with you today, and along with my co-host here, Pam.
Hi, everyone. I'm Pam Ostrowski, the person who sends you the reminder emails, along with some links and some information so that you can go ahead and learn more, either through the Kelch Communities Resource Center or through alzheimersfamilyconsulting.com so that you have additional information after you leave the webinar. I'm also the author of It's Not That Simple, Helping Families Navigate the Alzheimer's Journey, which is a dementia care guidebook, if you will, that's focused on all the things that you've been living because I went through this for 14 years with my mother, and my dad had vascular dementia towards the end. So that really made things complicated and challenging to try to deal with both of their care needs, which were totally opposite, by the way. And they lived in two different sections of a care community. So I feel your pain. I know that Paige sees families that are dementia caregivers every day. And so we've seen it and lived it, and we're here for you because no one should take this journey alone. So just a couple of logistics before we pop into answering all the questions from caregivers. One thing is our next webinar is March 24th. Same time, same channel, different Zoom link. So you will need to register. And if you don't want to receive these emails anymore, please don't click on the unsubscribe at the bottom of the email. Just reply back and say, take me off the list, please. And I'd be happy to do that. That helps with deliverability of the emails to everyone else. So unsubscribes are a bad thing when it comes to emails. So I appreciate anything you can do to help us out with that. So Paige, back to you and what we're doing today.
What we are doing today is we are going to go over 7 different questions, and we're going to go ahead and start with Pam. You've got the first question here if you want to go over.
Sure, I'd be
So I
happy
went
to
through the
do.
topic.
Okay, all right. So, and you guys, just so you know, you can put information in the chat if you have a question you want to add. And if we don't get to it today, then just we'll get back to you. I'll send an email to you or because I have all of your email addresses, and we'll address your questions. So with that, our first caregiver question was, my husband, who has early stage dementia, doesn't want any help when showering or getting ready for the day. One day when he came out of the shower, his skin was really red. And it turns out he had turned on the hot water to its hottest setting. Oh my gosh. How do I prevent this in the future? So Paige, tell us more about this situation and how
Yes,
you
this
would
is,
address it.
yeah, this was one of the families that I'm working with. The wife and her husband is very young. He's only 62. He has frontotemporal dementia at 58. Still doing very well, wants to be very independent. So, first and foremost, this was a very scary situation because, I mean, he was burning himself. I mean, that's very scary. But I always tend to, she's like, I don't want him to think that I am taking over and trying to fix everything and take over and caregive for him. But however, now is the time to really start supervising now that this has happened. But going in and making sure, hey, let's make sure that there's not a plumbing issue or, it's all in the approach. Why don't I go ahead and get the water warmed up for you? Let's get you started. Kind of putting the comfort back on to you as the caregiver versus saying, oh my gosh, you've done something wrong. Because we need to validate their feelings. And I think that that is so important. So, kind of shifting it back to the caregiver saying, oh my gosh, that might, or saying, therapeutic fibbing is okay. You can say, gosh, that happened to me the other day. Let me go ahead and check that and make sure, let me get that started for you. Shifting your comfort to you versus attacking them in any way is going to be a better outcome. And it did
Right.
help her. It did help her. But Pam's
Yeah.
got some really good logical, helpful
Yes,
tips.
yes, I'm the pragmatic one here.
You have the
Um,
practical tips.
so,
Yes, exactly.
so, one of the things that we need to keep in mind when we're in these types of situations is, just as Paige said, make it about you so that you're the
Mhm.
one who's helping, but not in that sense of, what's wrong with you, but instead let's get you, let's do this together type of thing. And we'll talk a bit more about that when it comes to other care type of things like brushing teeth. But the key thing here that you have to prepare is your home. And there are actually services out there who will come to your home and look at where grab bars need to be. These are specialists, right? They understand the physical needs of anyone as we get older, but specifically with dementia. And so you want to call a plumber, and if you want to actually set something at the plumbing level, right? He can actually, you can put a governor on the hot water
Other.
all the way around the house.
Yeah.
The other thing to do, which this is what I do, go down to the hot water heater and turn it down. It's very
Mhm.
easy. It's a dial, and the farthest to the right is really, really red, and the farthest to the left is blue. So if it's in the red, just turn it up and turn it down in this case, turn it towards the blue. Um, and get a feel for what that temperature is before your loved one's next shower for sure. And Paige, something else you'd mentioned was the shower chair. Did you want to elaborate on the purpose of a shower chair if you have a walk-in shower, preferably?
Absolutely. Because now that this is the time that in this circumstance, there's obviously the safety awareness is being jeopardized at this point. So having a shower chair to make sure that there's stability for when they are in the shower and also to help reduce from falls. And again, just say, if they're younger or there's mild cognitive impairment or there's an early diagnosis and they don't want to feel like you're, telling them what to do, always put it back on you. Hey, I use a shower chair. I want to make sure I don't fall. So let's just go ahead and try that, and make it more about you. But having that safety, that shower chair, that's going to help tremendously to help because you don't want them to start falling because falls do happen and they can start happening, you know, quickly. And we want to make sure that we have that kind of safe,
Right.
free zone and setting them up for success.
And that hot water creates steam, and steam can make you dizzy and you get overheated
Yep.
quickly. So even if you're in good health, you can actually pass out, just like drinking wine and then going in the hot
Mhm.
tub. They advise against that because you get dehydrated, right? So, all right, what's
Yes.
next, Paige?
Okay, so here's the next one. My dad continues to insist on driving his car to do shopping, even though we've noticed some new scrapes and dents on the car. Every time we try to talk to him about not driving anymore, it turns into an argument. He keeps saying he's fine. How do I have this conversation with him?
So
This one's a
driving
very
is
common one.
Yes, this is a very common one. We all live through it. And I think the biggest mistake people make is that they're like, well, the phraseology is everywhere in the medical profession. Well, it's time to hit the keys away. And it's like, no, it's
Right.
not time to take the keys away. It's time to take the car away. And this is again, what we're teaching you in these webinars is how to spin this differently so
Mhm.
that when we're talking about compassionate stories, which is you're not lying to them, you are instead taking into account their current mental capability and acuity and helping them do what it is they need to do safely. And so with driving, we take away the car.
Mhm.
And the way that you can do that is you can say, oh, it's in the shop. Now, this depends on the level of or what stage the person is at. But in general, you can say, yeah, I called the mechanic and he came by and picked it up and it's in the shop. And depending on what level they're at, almost always they'll be like, okay. Now, my dad had vascular dementia and he was very much aware, so I said, look, Dad, I'm going to take the car and park it at my house. And he's like, well, what if I need to get something? And I'm like, because he had actually fallen asleep in the car. Vascular dementia causes
Mhm.
oxygenated blood to reduce. So it was easy for him to fall asleep. And he fell asleep in the parking lot of a Safeway grocery store for several hours. And they put out, a big alert. The community was panicked. They called the sheriff's posse. This was in Phoenix, and it was a hot mess basically. And I said, look, it's clear that your health has declined, and I don't want you having a heart attack or something you don't have control over. I don't think you're a bad driver, but you can't control your health. You can't control the events that might happen. And I said, plus, you're pretty unstable on your feet. If you get a flat tire or
Mhm.
the engine overheats, you're going to get out of the car. The first thing someone who's preying on, an older person, they're going to see the disability of or mobility issues, and they're going to whack you over the head with that tire iron and take the whole car. And he's like, wow, I never thought of it that way. I don't like it. And I said, anytime you need anything, I will bring it to you. And so that's how I took the car, and he knew it. Um, and he was okay with it, but it's going to be hard. So what about you, Paige? What do you see this as?
It's going to be very, very hard. I mean, because as we all know, when we all started driving, this is our sense of independence. And people that have been driving all these years, it's a loss of independence. So, and saying that we worry about your safety, that's not going to work because maybe, dad's probably been able to drive just fine and had no issues, but now we're starting to see the issues. So, again, I would suggest to saying, you know what, Dad, traffic is so much busier today. It's much heavier than it used to be. I'm worried about this. I'm worried about the traffic and you
The
being
other
hit.
people.
The other people, instead of focusing on his failure. We don't want to focus on their failure. We want to focus on, talking about the situation, and we need to embellish the situation a little bit, and that's okay to do that. I do remember my grandmother had this exact same problem. My aunt did not do the right thing at the time, but that, she was doing
She
the
didn't
best that she
know.
could. She didn't know. And at that time, I was miles away and I didn't really know what was going on. But my grandmother was, gosh, she was 95 and vascular dementia. And my aunt kept everything in the house. She was in the driving. She took the keys away. My grandmother found the keys. And I mean, she hadn't driven in about a year and a half, and my grandmother was about 4'10". Well, she just stacked up phone books. And one of the neighbors saw her driving around and called my aunt, and it was very scary. So,
Yeah.
I mean, it is worrisome with the traffic today and their response time. Also, too, as we get older, I know as I get older, my response time is a little bit slower. So, making it about what's going on around them and not focusing on their deficiencies.
Right. And I think that across the board is really part of what you need to take from this is we put it on us. So we take
Yes.
responsibility and we use the proper word choice in order
Yes.
to help them. So I told my dad, I said, I was so scared when I got that phone call that they couldn't find you. And I
Mm.
said, please don't do that to me again. I'm running my own company and I've got a lot going on and I want to care for you and make sure that you have the best care possible. But you have to participate in that. And that means no driving, right? So it looks like
Right.
we have something from, I'm going to butcher your name, Amika. My
Okay.
client can do some ADLs and administer her meds herself. Woo. Hmm. But lately she's becoming more confused and attempted to take her meds second, if not for my seconds. Oh, second time. How do I communicate with my client's family that it's time for their mom to stop having access to her medications? Honestly, with the family, you can I would actually put that in writing, by the way, because there's
Hmm.
liability associated with that.
Yeah.
And absolutely say, in writing, I have witnessed your person trying to take the medications a second time. I highly advise that
Hmm.
these medications be removed from her from access. And now the question is, how do you control that? Like who keeps the medications? And that's the beauty. I know my mom and dad both had that with assisted living. They manage your medication, so you don't have to worry about
Hmm.
it. So Paige, did you have anything to add to that question?
You're absolutely right on that. Now that you've witnessed that, it is your duty. Um, as a mandated reporter, we all are, as caregivers, when we're caring for people, if you see something that's unsafe and that is definitely unsafe, you need to report that to the
Yeah,
family for sure. So,
yeah. In
absolutely.
writing, in
Yep,
writing,
in
and
writing.
and you
Hmm.
can call them and tell them that first, but follow it up with a letter to cover your liability. Then Amy says, Dad's 72 and had a stroke. And think about it, strokes are, when we talk about vascular dementia, we're talking about anything in the cardiovascular system. So that means if your loved one has had high cholesterol, any sort of heart attack or high blood pressure issues, anything that has to do with that, it's the body's no longer able to get oxygenated blood to the brain. And so the brain starts to deteriorate and has less capacity. So Amy she said his short-term memory is nil. So his brain is struggling, right? And so how can I essentially reteach him where there are skills he needs to live his life as independently as possible? If he has dementia, and the best way
Hmm.
to get a dementia diagnosis is not to take the mini memory state exam or the Montreal cognitive assessment, which is what most primary care physicians do. Use science. Ask the
Hmm.
doctor for an MRI. And that is where they scan the brain and they look at, and it's good to have a benchmark anyway. So just tell them,
Hmm.
look, we're going to get a benchmark on your brain because we don't want it to shrink too much. We want to stop that from happening. And usually people don't have an issue with getting an MRI. And then you'll know if he has some sort of dementia or how his brain is functioning due to the stroke. And he should have a neurologist because he had a stroke. So you probably already know who that person is. You cannot reteach him. So this is where caregivers need to step back and say, Stop it. Don't
This
try to
is the
change.
baseline. Yeah.
Don't change. You cannot change who this person is as they evolve through the different stages of dementia. You can't. So who gets to change? You, the
We
caregiver,
do.
have to change. Exactly. Did you have something to add on that page?
Nope, you
Okay.
nailed it.
Okay. So Amy,
It's hard to hear, but it is absolutely. It's
yeah,
hard.
and so just so you know, we did a couple of really good, highly attended webinars. One was called how to make your dementia caregiving experience as positive as possible, and the other one was do's and don'ts for
Do's
dementia
and don'ts.
care. Both of those are on alzheimersfamilyconsulting.com, which is the link is in all of the reminder emails I sent you, and go to the Learning Center. And there's a ton of videos on that to help you walk through how you need to handle this situation. Okay, Paige, next one. My
Right.
mom has early to mid-stage dementia. Okay, so yes, I can. So the challenge with that early to mid-stage means that she's got limited language skills, limited communication, limited ability, if at all, to do activities of daily living as far as dressing or showering or eating. There's lots of different, everybody's unique. So my dad insists he can take care of her. Oh boy, this sounds familiar. Both are in their late 70s. However, I've noticed mom is losing weight. What's the best way to get my dad to open up about moving mom to a memory care community? Here you go, Paige.
Ah. Well, weight loss is definitely one of the key symptoms, and weight loss is definitely a sign of decline, particularly, but it's also a sign of caregiving or lack thereof, and lack of expertise and keeping up with caregiving.
Skills, understanding what you're supposed
Yes,
to be doing and how to
that's
communicate.
right. I would, t trying to talk to your dad about, options of moving to an assisted living, whether it be both of them in assisted living or mom just to memory care. Start with curiosity. I would always start with curiosity. Dad, how do you think things are going? I've noticed mom's pants are a little bit loose and gosh, she doesn't seem like she's, eating as well, and she looks like she might be losing weight. How do you feel about that? Um, Start trying to get him to talk about things first and see if he'll, gently, because this could turn into a big blowout.
Don't tell me what to do. Yeah.
Yeah, don't tell me what to do. You know, um, and say to, ask him, do you notice mom's pants being bigger? Do you think she looks like she's lost weight too? Because it sure seems like that to me. And it can just be kind of a launching pad to open up a conversation. When you start asking questions to them, put it back on them, and then they will start opening up,
Ask
hopefully.
questions. So
Ask
important.
a lot of questions.
Yeah.
Those are really good, conversation starters, because, dad might say, you know, and maybe most of the men are pretty stubborn and very prideful.
What?
Um, but again, there's the flip side of that too, is most men that are very prideful, and most all of them are, they're never going to ask for help. Ever. They're never going to ask for any assistance or anything like that. This might be a good conversation starter too, that where you can say, you know what? Why don't I come by and, we can start doing some meals at the home, or start seeing if he'll even take any assistance. And then you can keep that dialogue going, so where you can, continue those conversations to where you can start to talk about moving to an assisted living.
Yeah, yeah, and those are all good points. And so I lived this. My
Yes, you
dad
did.
dug his heels in. He's like, "We're fine." And I'm like, "Okay, so let's do an inventory of what's in your kitchen." And
Yes.
I which he didn't expect, so I kind of surprised him on that one. And I'm like, "Great. So you have milk and you have cereal, and then you have frozen White Castle burgers and French fries." And my mom had just had colon cancer, had just had surgery to remove a tumor in her colon. And I said, "There's no fiber in any of this stuff." And soup. He loved to fix soup because you just have to heat it. That's about it. And I said, "This isn't," he's like, "Well, we go to the Golden Corral, I think it is what it's called, one of those buffet type places, and she can have her salad there and that kind of thing." And I said, "Dad, nutrition's really important at this stage of your lives. And we already know that she has bone density issues, so we need to walk through this." And so I don't, a lot of people will call that denial. Oh, he's in
Yeah.
denial. No, he's resisting. He's
Yes.
not denying what's happening. He's very well aware that she's declining. However, he's resisting change. And honestly,
Mhm.
most of us, about 42% of the population, actually hates change. Like, it doesn't
Right.
matter what it is, we hate change. And so, you know, he doesn't want to be told what to do. And I made this mistake, so I'll just raise my hand now. But instead, you have to approach this word choice. Wording matters, to say, well, like Paige gave great examples, but what can we do about the groceries? And back in the day, they
Mhm.
didn't have Instacart and all those different Home Chef and all those different food delivery, meal delivery places. So, and he didn't want to do that. He didn't want to spend the money. So, it was just, Dad, we need to do something. Do you agree to that?
Mhm.
And so take small steps. This
Little
is a
bites.
multi-conversation discussion, because if you try to do it all in one fell swoop, he will feel attacked.
Mhm.
Never make these one-on-one conversations, by the way. Do not have all the kids come in and sit down and say, Dad, we need to talk.
Don't do
Because
an intervention.
exactly, because it feels then like you're being attacked and it will not go well. Trust me, because I did that. My brothers and I my brothers got on the phone and we started talking, and Dad had written up a letter of rebuttal. So, but here's another aspect of this particular conversation, is what I'm hearing from a lot of my both male and female clients is, if my loved one moves to memory care, who am I? I've been
Right.
taking care of this person for decades, or I have watched over them, or they've always been here in the bed next to me,
Mhm.
and you're trying to take them away from me. What an interesting way to perceive getting better care for your loved one. You're taking that person away from me. So when you're having these conversations with your loved ones, you have to take that into account, that the resistance can very well be because they feel like if they're not a caregiver, who are they? And they've
Right.
given up their social life and their friends because they've created this codependent bond that
Right.
doesn't allow for them to do anything.
It's
So,
taking away their purpose,
and their independence and
their
everything else.
independence.
So,
Yeah.
yeah, so that's really
And that is such a hard one, Pam. You are so, I deal with that with the memory cafe that Elaine and I facilitate at, and it's so hard. It's learning learning to have a life after your loved one has either gone to a memory care community and or passed away.
right. Or even before that. So, what
Yeah.
I try to coach my dementia caregivers on is, you need to bring in home health, someone who can watch over your loved one, keep them stimulated, take them for a walk, whatever it is that your loved one can do. And you need to go away for 4 hours and go out for lunch,
Hmm.
go see the guys, go golfing, do some activity at least 3 times a week. You need to get out of the house, because that is not good for your mental stability and brain health. So
Right.
that's a hard one though, because they're worried, right? So, I get it, but not it's not good for you. And your loved one would not want you giving up your life and your well-being for them. So,
Hmm.
you have to keep that in mind and keep that as part of your focus as a caregiver, is to have boundaries, which we're going to talk
Yeah.
about in a bit. Okay, Paige.
Yes.
What's next?
Okay.
I think it's number
My
4.
dad and I both have tried to get mom to brush her teeth and she resists. So we give up. This is bad for her health. How do we get her to brush her teeth?
Yes, so this is actually a live example of someone I know. And one of the things, again, this goes back to word choice and presentation, which Paige has covered well. It comes down to show, don't tell.
Hmm.
So we are so good at wanting to swoop in and take control of the situation and be like, all right, so you need to brush your teeth. Well, I'm sorry, but first of all, if you're my adult child and you're telling me to brush my teeth, that's not going to go over well. Secondly, it also comes down to, they may not know what brush means. They may not know where the toothpaste is. They may not remember the action of brushing teeth. So it's really important for you to show, don't tell. So bring your own toothbrush,
It's right.
and this worked actually, because they had actually brought a dentist in and to clean this individual's teeth, and the husband was like flailing his arms and pushing the dentist away, and the dentist is like, I am not doing this, because he clearly doesn't want it done. And so I mean, she tried everything. And I said, did you try to brush your teeth next to him in the bathroom?
Right.
She's, well, no. I'm like, okay, so try that and let me know how it goes. And I got an email from her the next day, and she's like, oh my gosh. It never occurred to me. Same is true with putting on shoes
Dressing.
and,
Hmm.
putting on your jacket. We tend to tell a lot. We don't actually show much.
Yeah.
So it's really important that no matter what you're trying to get, this is the art of persuasion with someone with dementia.
Mhm.
It's about showing them, because words are hard to remember, and we lose as the brain shrinks and there's little holes and gaps and stuff in it. We lose the ability to recall specific words. So maybe you use a different terminology if you want, like, well, let's clean our toofies, whatever you come up with. But the best thing to do is to brush your teeth yourself. So, Paige, what have you seen work at the care community?
So in a care community, yes, the nonverbal cues are helpful. Not that the caregivers are all doing, I mean, they're doing this, but they're not technically brushing their teeth with them. But the care staff have much better luck because number one, they're doing this all the time, 24/7. They have the skill set, a lot more skill set than the family members do. So it is the nonverbal. So it's helping them put the toothbrush in their hand, showing them what to do, giving them that nonverbal communication. Also, our professional caregivers understand, they just know how to approach. And if it's not a good time for them, then they're going to come back maybe 20 minutes later and try again.
Yep.
Sometimes we have to use a different caregiver. Now, I'm not saying every resident that we come into contact with is going to brush their teeth and it's going to be successful every time. That is not true. However, with the experience that we have a much higher success rate. Also in our community, if we have some very difficult challenges where maybe we have, some behaviors going on, or maybe somebody's got a urinary tract infection, they're going through something that's very difficult at the time. We do have a mobile dentistry that comes on site into our Kelch communities, into our memory care communities, and they can professionally brush their teeth on site right there. And sometimes we have to use a mild sedative, maybe, to give them a pill an hour before, a deep cleaning. So we have lots of different challenges throughout the day, but
Those
we have
two.
lots of solutions too.
Yeah,
So,
absolutely. Absolutely.
yeah.
Yeah, and the thing that's important to remember is that just because something worked once doesn't mean it's going to work again. This
No,
individual is
no.
evolving on an hourly, daily basis, and what they remember, what they don't remember, what they can do, what they can't do. And so you've got to have a bunch of, I believe the phrase is arrows in your quiver, tools in your
Yes.
toolbox.
Tools in the toolbox.
Um,
Yes.
to try out, and Amika brought out also a good point about it comes down to approach, and that's exactly
Yep.
what we've been talking about. And oh, by the way, my mom would not eat when my dad told her to, but if a caregiver came up and said, why don't we try these peas? That I think the peas would probably taste pretty good. You want to try the peas? And sure enough, she would eat all the peas, she'd eat all of her chicken, she'd eat everything. And my dad would just sit there and say, I don't know. He'd get really upset. I can't believe,
Yes.
she would do that for her and not for me. And I'm like, because you're pushy.
Yes. Yes. Exactly. Well, and too,
Okay,
and
Paige.
the task too with the teeth brushing. I
Mhm.
mean, if you think about how many different steps it takes to get your teeth brushed. I mean,
Yep.
we've done an exercise like that before, taking off the cap, squeezing it, I mean, there's
Yes.
so many steps that they just can't
It's too
quite.
much.
It's too much. It's
It's
way too
too many
much.
steps, and that's the thing to watch for. If there's too many steps or too much in the process, too many tasks, small tasks, micro tasks, yeah, that they're going to struggle. So
Yep.
just understand where this is headed and try to, head it off at the gate, so to speak.
Yep. Simplify. Big
Yes,
time.
exactly. All right, Paige. Next question. I don't know much about what happens in a memory care community. Well, we've got an answer for you. I hear that it's better for my mom to be in a community now that her dementia is declining, but I really don't know why. Can you explain why that environment is better for her than staying at home with a caregiver? Go for it.
Well, most memory care communities, and especially a Kelch community, is focused on dignity and respect of the resident while providing stimulation and engagement. There's watchful staff to make sure residents are supported in everything that they do. Our memory care environment is purpose built. So our communities, we have the endless hallways for them to walk and wander for residents that they're among other peers. They have care staff to help them 24/7 hours a day to help reduce with anxiety and confusion, to help redirect them. We also have on-site licensed nursing 24 hours a day. So our staff is there and available to really be able to monitor a higher level of care to see if there's a urinary tract infection. Do we feel like something is maybe a medication? Maybe there's a medication change and we need to, maybe take something or titrate something back. What can we do? But the engagement piece in a memory care community is so important. Um, Not only is it just care staff, but a lot of families really are focused on what is your staffing ratio? What is your caregiving staffing ratio? And they're very focused on that piece. Well, in our communities, I would hope to think all of them do, but in our communities, every single department, meaning from the housekeeper to the laundry aide to the dietary aide to every department is trained in dementia. So it's not just the care staff caring for your loved one, it's the whole community, all the leadership team, all the different departments throughout the day. Our active living coordinators take residents to the bathroom. They help with dressing. They're bringing them to engagement and they have friends. So having that social environment is so important for them to be able to keep what they still have and it keeps them from declining faster when they have the engagement.
Absolutely. Absolutely. And that's a good point. I know that some of my favorite photos of my mom at the Rock Creek in Surprise, which is also a Kelch community, um, she has this big chef's hat on, like the big poofy one you
Mhm.
see in the Lindt chocolate commercial. And she's got an apron on and she's got this big bowl and she's got a spatula and she's stirring and they were making cookies.
Yeah.
And her job was to do this. And the caregiver, showed her and the chef was there and she's like, and they all oohed and awed over the cookies and everybody felt, rewarded, like they'd done something that was familiar. Maybe not, they didn't
Mhm.
remember how to do all the steps, but it was something familiar, smelled really good, it tasted really good. And they also had that sense of stimulation and that sense of people care about me and
Yes.
people are including me, even though I have this
Yes.
disease, because they're still in there. Just so you know, if you think that your loved one has disappeared and they're gone, you are
They're
wrong. They
not.
are always in there in their core. But the problem is they're trapped. Imagine that for a moment, being trapped in a body where, like, my mom couldn't speak the last 8 years of her life and couldn't walk the last 5 years of her life. So the caregivers had to be really on her to watch and have her on a regular toileting schedule and watch what she ate because she couldn't yell or say anything really. So because of that, it was so important to pay attention for everyone else, all of the staff, whether it was the caregivers, the activities director, the chef, or laundry people. Um, you
Mhm.
know, you know, Loretta's socks don't match. Why is that? And if somebody would be go to the dryer and get the other socks. So it is when we call it a community, it's not a facility. You use a
No.
facility to pack meat, you use a community to support the people who live in it. And that is so important. And for the person who asked this question about what's the difference, oh, that is a good question. Amy, that's also in in the Learning Center. But if you're asking, it's probably time,
It's
by the way.
it's probably time to start looking. Yes.
Yes. And
And
that's something too that I think you and I had talked about, Paige, is go look.
go look.
Go look at two or three communities. Just tell them you're just doing research now so that they're not,
Right.
trying to push you into the environment. But, go speak with the nursing, ask to speak. And I actually have a cheat sheet. I'll put the cheat sheet of questions you should ask But for us, and everybody's different. Like for us, my
She
dad and
just
me,
answered, yeah. Hmm.
I want a 24/7 a nursing capability so that in case anything happened. But other people are like, oh, who cares? That's not as important as what are the activities? What's the calendar look like for stimulation and that type of thing? And activities are also, that was second on my list. So yeah, very important. And
Start.
day program, you want to talk about that page?
Yeah, day program is if you're looking at considering, I mean, family members are, this is one of their biggest fear is, oh my gosh, how are they going to act? How am I going to get them in? How are they going to react? How is this all going to go down? Please walk me through this. A day program is a wonderful option to start to see how your loved one is going to do when they're interacting with other people like them. They actually start fitting in. And if they're in an engagement piece, if they do well in a day club, or an adult daycare, which we have day stay at the Kelch communities and all of our memory care communities, if they do well in that type of setting just for a few hours in the day, that means most likely they're ready for memory care because they're
Okay.
doing well and they're fitting in because they're with people like them. And sometimes they're having conversations that maybe don't make a whole lot of sense to maybe you and I,
Exactly.
but they're having a conversation and it comes and goes. Um, but definitely is a great interim step is a day program. And like I said, Kelch Communities we call it hourly day stay. And you can just say, hey, mom, dad, or whoever you're caregiving for, I want to go, we're going to go check out this club. I'm going to go with you. And you go with them for an hour or two and just observe and try it a few times. But
Yeah.
if you're questioning it, it's definitely time to start researching and looking.
And Amy said, as of right now, I have him in a workout program and we are going to a senior center. I think he is still too idle. So that's an interesting statement. Um, he too idle is who they become when you said too idle. So they aren't going to be as active because there's things they can't do. And the more idle that they are, that's actually one of the symptoms of when it's time to move to memory care because they can't do more and they're
Right.
unmotivated. And actually, research shows that men tend to get more depressed than women do when they have dementia. So the senior center is not trained with people with dementia. You really need to find programs like the Memory Cafe.
Right.
Oakwood and Phoenix has one. I don't know where you are, Amy, but there's places that will have dementia type activities. They know
Mhm.
how to stimulate the person and get them engaged. So, because the senior center, their assumption is the only reason why you're qualified is because you're, 60 and over and then you
Right.
can just go do your thing. But they don't have as much guidance, let's put it that
Right. They're
way.
not going to guide you and cue and prompt and help, get you started and really get you engaged and started. They leave you
Right,
on your own. And
right,
it's up to them to make their own decisions and engagement. And
right. And
if
then what
he's
person
not
with dementia?
capable,
Right,
yeah,
exactly. So
yeah.
yeah, so that's something else to keep in mind. And then I will, if you go to the Learning Center, you'll see a whole bunch of there's signs and symptoms, and we do talk about when it's time to move to memory care in those different videos. So if you have any questions about which videos to find that information, just email me. Just reply back to the email I sent today, and I can get back to you on that. All right, page number 6.
Okay. Number 6. Okay. My mom lives alone in an apartment and is early stages of dementia. I do my best to visit every day, check on food, and keep the house clean. But she gets angry with me almost at almost everything I do. We haven't always gotten along in the past. Is that a problem?
So
Mm.
the I call it the swoop, where we as caregivers want to swoop in and take control over everything.
Mhm.
And that removes their sense of purpose. It removes their confidence in doing anything right. And so what they do is they fight back. They get angry. And then of course history rears its ugly head. And what you remember as a caregiver, especially, sons and daughters, is, oh, you're just mad at me because of X, Y, and Z. And it's like, no, first of all, if you had early stage dementia and you knew that you couldn't remember what this is, and you know you don't remember what it's called, it's frustrating. It is
Yeah.
natural for them to lash out or be angry. And you coming in and trying to take over can create a whole, mess of anger and negative
Mhm.
emotions. And so instead of trying to fix the problem, walk with them on the journey and
Right.
make sure that you have collaborative conversations.
Yeah.
So it's kind of what we talked about earlier about the, brushing teeth and taking a shower. And, it really does come down to not, we see them as vulnerable, and so we take
We do.
over, and that's the worst thing you can do. So instead, work with them and say, okay, well, let's make cookies together, or let's make dinner tonight together. I need some
Right.
practice, and you can show me what your tricks are, and make it a moment of joy. Work with
Mhm.
them to do something together, whether it's cleaning the house, it's like, I'll race you, you do the upstairs, I'll do the downstairs. And, make it enjoyable, because this person is slowly evolving into someone who's not going to be able to do even those things. And now's your chance to create those memories for you. Paige, what would you suggest?
Well, you know, this concerns me a little bit because they haven't always gotten along. So
Right.
that to me shows me that there's going to definitely be a trigger topic. So she could be triggering mom just because of their relationship in the past, or, that they don't get along. So it's all about reframing and putting it back kind of on you and saying, Mom, I need, would you go grocery shopping with me? Make it an experience, because she thinks definitely that you're attacking her. And she probably knows what's going on. Not everybody that has dementia knows what's going on, but they do know something is happening. And so that creates a lot of anxiety, can cause agitation. So just really just lead with kindness. We have to shift ourselves as caregivers and lead with kindness and love, and really make it about, Mom, I need some help. Would you help me? And that will usually always get, if you as a child or a spouse need help, they're definitely going to want to do whatever they can to help you. So it's really about reframing and shifting your approach in any way possible. And it can be silly, doesn't have to be perfect. Nothing is perfect. Um, but also too, if you lead with kindness and love, you're going to get a good result.
Yeah. Yeah. Um,
I was trying to
I
pull up the guide program because the guide,
I'm the
are
typing
you
that
pulling
out.
it?
Yeah.
Okay. Yes, there is help with
Yeah.
there is
So
help in the guide program. Yeah,
yeah,
there
so
you go.
it's the guide program, which is a dementia specific program, and people, so service providers like a memory care or in-home health or day stays can participate, and then they link you together so that you get the financial assistance you need. But by
Mhm.
default, if you don't do some research on the guide program, you can always go to your states. Every state has an area agency on aging, and
Mhm.
you can go there and they'll point you in the right direction as well. However, by default, everything's private pay. Medicare covers your medications and your doctor's visits. It does not cover any sort of living or daycare type of situations, just so you know that. So that's why it's long-term care insurance will cover those types of things. So for what it's worth, there you go. Okay. So I think
Did
we
we
covered
answer?
that. So we're on to number 7.
Okay.
Um, the my so what the caregiver has said is, my mom is accusing my sister and me of stealing from her every time we visit. It's causing so much stress for us. And by the way, this is typically a symptom of uh vascular dementia
Vascular.
or Lewy
Mhm.
body. So
Yep.
behaviors usually fall into those two types of dementias. There's over 100 different dementias. So I wouldn't get caught up in that so much. It's just
Right.
good to know if you're seeing behaviors, what type of dementia it might be. So Paige, how do you deal with being accused of stealing something?
Ooh, well, you definitely have to validate their feelings because this is very real to them. And don't, you want to make sure that you validate the feeling, not the accusation. You're agreeing with mom or your loved one that, okay, you know, I understand you, I'm sorry to hear that. I can see that you're worried. Let's maybe go look around and see if we can find it. Let's look together. Sometimes things get put somewhere else. And you can always say, my gosh, you know what? I lose stuff too. So let's just try to go look together. Um, Shift into problem solving mode after validating, but gently pivot. That can help redirect. Hopefully you can find what it is and you can, say, okay, let's put it in a safe place now and we'll just try to, this is going to be the place that we're going to put it.
Mhm.
Um, and oh my gosh, it must have been misplaced. There it is. So
Right,
kind of putting it back on, just the situation because validating their concerns and their fears of losing something because oftentimes they're blaming someone else, but internally they possibly know that they can't find it and they've lost it too.
right,
So
right.
do you know what I mean? So it's a combination of kind of a both of several things, but validating their concerns and just really trying to redirect. And also I'm always up for blame going, you know what? My gosh, I lose stuff all the time. And
Right.
you know what? I
Empathy.
can't
Yeah.
believe I did that. And
Relatability.
geez, I know how you feel.
Yeah.
And really putting it back, off of them and making sure that, that they they don't feel
Alone.
bad about it. They don't feel low.
Right.
Exactly.
Yeah. I mean,
Exactly. It's
we
a hard
all,
one.
yeah. And it's one of the biggest challenges when we talk about that in the positive dementia caregiving experience video is we're having to change how we speak, how we
Mhm.
communicate, what word choice we have, and we have to put our egos in an entirely different room. We have
Yes.
to put our history, good, bad, and different, in another room because
Right.
this person is a different person. They relate differently. They're having challenges with their cognitive ability, their memory, their ability to do tasks. I mean, they have a lot on their plate. So being empathetic and saying, you know what? The doctor told me I need to go for a walk more often. And so would you do me a favor and help me out? And let's go for a walk together. So you see how that's different than dad, you're supposed to get more exercise. Let's go. Come on, go walk with me. It's harsher to talk like that. And frankly, there's nothing wrong with having a kinder, gentler way of communicating with anybody who's older. So I think that's really important. So, Paige, did you want to go through additional questions?
Yes. We've got a couple here.
Yeah, we only have 5 minutes, so pick one.
Ah,
Let's see. Some of them are about boundaries. Okay, guys, we're gonna do a poll, so pay attention. We're gonna ask you to pick one. These were the
nice.
responses to the email that I sent out asking what your challenges are. So, how do you deal with grieving as you've watched this person change? How do you handle I want to go home? How do you
Mm.
handle mood swings? How do you, let's see, what to do if your spouse gets angry or very argumentative? Anybody, anger? Christina said, everybody beat out, anger. Oh,
Anger,
wow.
yeah.
Anger's a thing. So, with anger, and let's see. So the caregiver said Thank you so much for having the Zoom webinar. One of the issues I'd like to discuss is how to handle your spouse when they get angry and very argumentative. This also applies to adult children. And when they insist they've
Yes.
done something they were supposed to do or not supposed to do, and you know for a fact they didn't do it. So you notice there's a lot of contention in the way that she wrote that. That it's, I told him to do it and he didn't do it and he said he did it. And it's like, okay, so let's again put that ego, put that expectation in a box because you
Mhm.
can't have expectations of them anymore. And the
No.
reason why they get angry is because you're angry. They reflect, they're a mirror.
Mhm.
So when you have a conversation with them, it has to be from a calm, kind place in your heart. Then say, "Well, I'm sorry. I wish I understood better." Or you can say, let's see if we can't work together to fix this." Whatever is that
Mhm.
they're angry about. She didn't really give much information, but if taking vitamins, she gave that example. So first of all, how do you know that he didn't take the vitamins? Two, um, you can segment vitamins into pill boxes, and then all you have to do is lift it and say, "Oh, you know what? I forget to take my vitamins sometimes too. Let's take these together. Let's make sure don't take extra vitamins or medications, obviously, if you don't need them, but
No.
help them see that." This is, and you'd never want to put them in a position of defensiveness where it's like, "Well, I thought I took them." And it's like, "Hey, I get it. I do that I have that challenge too. But since you didn't take them, let's take them now." And so that you can, help your brain stay healthy. You can say something like that.
Mhm.
But with angry, so my dad used to get really angry. Again, vascular dementia, Lewy body dementia, much more the behaviors. Um, but he used to get angry and he got really angry with me. Uh, they were moving my mom out of the apartment that he and she shared, and they were moving her to memory care. And I said, "Dad, stop yelling at the caregivers." And he's like, "You don't understand." And I'm like, okay. And I had two choices: reflect temper and anger back, right? And say, "What are you talking about? You're the one who doesn't understand what you're doing," whatever. And instead, I said, "Well, why don't you help me try to understand?" I said, I can't be you. I can't be in your shoes. I know it must be hard to watch mom leave, but it's just going to be better for her. You don't know that." And I said, "Well, help me understand." And he was quiet. And then he said, "This isn't the way it was supposed to be." And I've heard more male spouses say that phrase. It's heartbreaking. And I said, "What way was it supposed to be?" Now, he was 6 years older than her. And he
Mhm.
said he had always expected him to go first. But she disappeared in a different way. And he said, "This wasn't the way it was supposed to be. She was supposed to take care of me." And your heart's breaking, right? Because this man lived his entire life, 60 years with this woman, and they had expectations of each other. And he just didn't know what to do with all of these emotions. So he was getting angry at the caregivers for no justified real reason. Um, and so we have to be empathetic. We have to ask those questions. We started this webinar talking about how important it is to ask questions. And it's like, "Help
Yes.
me understand. Help me to know better how I can help you." And that level of tone, of course, not yelling and not, getting upset, because it's the worst thing you can do. Paige, what do you think on the angry thing?
Oh, I think you're absolutely right. You're never going to win an argument. Don't even attempt to to argue back, or you even, don't try to be right. It is you don't know how they're feeling. They're feeling overwhelmed, they're feeling anxious, they're feeling agitated. Just asking questions in a loving manner and just being there for them and trying to help them cope through what they're dealing with in a very
Yeah.
loving manner.
It almost always comes from fear. The anger comes from
Yep.
fear. Something went wrong. So watch for those triggers. There's another video in the Learning Center that talks about triggers and what triggers behaviors. So watch that one too. And that'll help you too with the mood swings and I want to go home. But I also have a blog on the I want to go home. I think Marie had asked about. Just quickly, the way we use the word home, if you think about it, if you
Yes.
said I want to go home, you meant I want to go to someplace comfortable that I feel safe in, that I know I can be normal. That's what they're
Mhm.
asking for.
Oh,
They're asking, I want to go to the place where I'm comfortable and normal and things are like they used to be.
right.
They're not
Yeah.
asking for a building. They're not
Right.
asking where they live. 9 times out of 10, when they say that, they're already at home. They just don't know
Right.
it
That's right.
because they feel so lost. It's like, I want
Hmm.
to go back to the place where I felt better. Well, and I can't blame you. And so, being able to say, you know what, I love home too. And you say, I remember when we used to make cookies in the kitchen on 10th Street, and use examples of things you loved about home. And they'll get distracted by the stories and
Hmm.
they'll let go of that I want to go home. But that's what it means. It doesn't mean I want to go back to the building I used to live in.
Right. It means something that they remember that's comfortable.
Safe.
We had just came up last week, and it was the husband's like they're snowbirds. They go back and forth, and they've been in the one home for, so long, and they've been in Arizona for 30 years traveling back and forth. And he says, she wants to go back home when they're here, and then when they go back to the home that
Yeah.
they've been at the longest, she still
Want
says,
to go
"I
back
want to go
there.
home." So it's just it's a place of familiarity and a place of comfort.
Yep.
That's what
And
they're
it
looking.
usually that request happens soon after you've either moved them into memory care or assisted living or you're changing homes. So what they're really saying is I'm disoriented, unfamiliar, I don't feel safe. Fix it.
Right. Right. Exactly.
Yeah.
Exactly.
Yeah. All right. We are over on time. Thank you guys for
Yeah,
participating in
thank
the
you.
chat. Always appreciate your feedback, whether it's through emails or through chat here. And our next one again is it's March 24th, same day,
Yes.
24th, and same time. So watch for that. And we'll be sending out emails to everyone who participated with the recording on Friday. And and if you have any questions, if you're watching the recording and you have questions, just reply back to my email. If you have a question for Paige, I'll make sure she gets it. And we'll kind of go from there. So bless you
Thank you all for joining.
for being caregivers. Take good care of yourselves, okay?
Yes, you're all caregiving heroes, so
Yes, you
keep it
are.
up.
Yep, exactly. All right, thanks so much, Paige. Appreciate
Thank you,
it. And
Pam.
you take good care of yourself, and we'll talk to you all soon.
We'll talk soon. Thanks. Bye.
Bye.